Welcome back to the Career Series, everyone. Thank you so much for taking the time to catch up with Kestner. Today, we have a master's in public health student at NYU and a new friend that I just made recently. So go ahead if you are interested in hearing more stories about masters in public health or community advocacy. Like, share, subscribe, comment, download the episode, whatever platform you're on. We both really appreciate that. But Chris, thank you so much for joining me today.
You for having me. It's a pleasure.
I'm excited to get into it today. But I guess just starting off for everyone, Chris, for the people that don't know who you are, quick introductions. Who are you? What are you up to? We'll start off with that.
Okay. My name is Chris. I'm from Westchester, New York, which is a suburb right outside of the city. I am a second generation American-Filipino, and like Kestner said, I am an MPH student at NYU, finishing up my degree. I am also a gymnasticker, and that's all I have for right now.
Nice. A lot of good things that we'll get to talk about today that you mentioned.
I did it through anthropological and archaeological scholarship, and I think that made it quite unique, such that when I went on to pursue an MPH, they knew that I had it within me to uplift American-Filipino and Phil-Am health.
Yes.
So when I entered the MPH program, I searched through a wide variety of faculty and discovered that one of the deans of the nursing school is a Filipino-American scholar. He happens to also be Ilonggo, and
Wow.
he also happens to spearhead an organization called Kalusugan Coalition, which directly translates into Health Coalition.
Mm-hmm.
There, I was able to, and I'm still able to, connect with the Filipino-American community in Queens as part of a patient-centered outcomes research project. And through what I specialize in, which is qualitative data analysis, I'm able to exercise that in the context of being Filipino-American. So we as a collective discover what are the issues going on with Filipino-Americans, and as it pertains to health and chronic diseases like heart disease, obesity, cancers, how do those interact with the coronavirus, for example?
Wow.
Culturally, as well as resource-wise, because not every Filipino-American you meet is of the education of the stereotype nurse.
Yeah.
Some of them come here with a high school education and they work a different job.
Yeah.
And that's amazing, because that's the heterogeneity of the Filipino-American, American-Filipino identity.
Yes.
So through that kind of scholarship, we're able to investigate and demystify the model minority myth, which states that Asian Americans and Pacific Islanders are the models of the minority because generalizably, they're of a higher income and higher wealth, otherwise known as socioeconomic status, or SES, is associated with better health. But culturally, and maybe you know this through the Filipino Americans and American Filipinos, that's not the case for all of them.
Yeah.
We're still in poor health, and it's masked by our wealth. The last time I did research on this, I believe the U.S. Census Demographics suggested that the median income was about $80,000 for Filipino Americans. That's a lot of money, and that's a lot of health.
Yeah.
And why are we suffering from chronic diseases? Why is that happening? So that's one. Two, with the LGBTQ community, here's a research question that I investigated in one of my field methods classes. How does lack of LGBTQ education impact an ER nurse's ability to provide care?
Wow.
I did a pre-test interview with an ER nurse in New York City. And this is just the sample N equals 1. So
Yeah.
this hasn't fully been researched to the rigor that I could make these kinds of claims.
Yeah.
But just to make an example of how I use my intersecting identities to propel what I'm doing in my career or scholarship, is I'm using what I know from my experience, and I'm investigating how things are poor and how we could make them better for these intersecting identities. So
Mm-hmm.
roughly, I discovered, and this is documented in the scientific literature, that because there are so few hours in nursing and med school curriculums, the care that clinicians provide in the emergent setting is sometimes insufficient
Mm.
for people of alt from heteronormative sexual orientations and gender identities. So to go even further into mental illness, I recently attended a Filipino-American public health conference, and I attended a talk about civic unrest and mental illness exacerbation due to the coronavirus pandemic, because that's also documented in science that quarantine
Yeah.
and new ways we have to socialize in person or remotely is taking a toll on generalizably people's health.
Right.
And that, I think, was the first interaction in which I came out to strangers as I'm American-Filipino and I have a severe psychiatric disability.
Yeah.
So before I did that, I had to come to understand, what is it like to be of a severe psychiatric disability? And in my education, I learned about roughly schizophrenia in China and how policy and epidemiology informs how we provide systems, community-based systems, to help those of severe psychiatric illness. Personally, I did it through X and Y plane by showing up as both American-Filipino and with a mental illness.
Yeah.
Do there exist others who are of the same three-dimensional plane? I'm sure.
Yeah.
How long did it take me to arrive at this conclusion that I can use that through XYZ plane? It took me until this semester.
Forever.
Forever, yeah. I mean, I just turned 26. So it took a while.
Yeah.
I mean, I knew I was all of these things, but I only had the capacity to be those things one at a time. And that's my advice for if you're going to use your identities and oppressions to pursue or progress something, social justice. We'll call it social justice.
Yeah.
One at a time. You do it one at a time, and when you're ready, maybe two at a time.
Well, Chris, we've talked a lot of great things about your story, how you grew up, and I'm sure a lot of people can relate to your stories, and that's the most important thing too, right? And knowing that there are people that maybe you and I won't even meet, but maybe listening to this and say, I can relate to that, and that's the most important thing. And how knowing that they can push through it and that they can find solace or they can find inspiration in that. But we also talked about what the MPH program means to you and what it's allowing you to do in New York and even past that. I know you're applying for a PhD program, and that's awesome. You know, furthering your education to have a even bigger impact. but also talking about what advocacy looks like through community empowerment, but also being humbled in that fact. So I just want to say thank you, Chris. For everyone else, thank you so much for tuning in today. Let us know what your favorite theme was from this podcast right in the comments. Let us know your thoughts, how you continue to empower your communities. But Chris, until the next time, thank you so much.
Thank you, Kastner. I really appreciate you having me here.
Of course. I'll see you later.